everyone, we are from Group 2 and we will be presenting our topic about hearing aids for the basic anatomy and physiology class. And our group consisting of 6 members: HILDA AULIANA, Michelle ANNICE TJITRA, NAUFAL IKRAM, RUSYDA FAJARANI, SURYA SASMITA, and YOVITA EVARISTI HAREFA. The table of contents: first, introduction, we'll be explaining about autosclerosis. Second, methods, explaining about how to diagnose. Third, discussion, and the hearing aids will be explained here. And the fourth, conclusion.
Autosclerosis, also known as autospongiosis, is an abnormal shape change of bone in the middle ear. Autosclerosis occurs in the bone capsule of the ear labyrinth. The endochronal layer of the labyrinth bone capsule is replaced by irregular spongy bone, then hardens, becomes sclerotic. As the abnormal growth continues, the hardening of the bones can extend to the stapes bone. In the normal condition, the sound is conveyed from the external acoustic meatus to the tympanic membrane, then simultaneously triggers the ossicle bones towards the inner ear. In autosclerosis condition, the stapes bone becomes stiff, causes the sound vibration that enter the ear to be abnormal. The inner ear cannot receive the whole vibrations, and then hearing loss occurs. Autosclerosis usually causes conductive deafness. In severe conditions, it can lead to mixed deafness and sensorineural deafness when the disease spreads to the cochlea and auditory nerves.
In this section, I will explain about the diagnosis system for patients. To confirm the presence of the disease, doctor will conduct a thorough medical interview, a complete physical examination, and an ear examination. To carry out this process, we need to better understand the cause, risk factors, and a current diagnostic test in the disease, which in this case we will discuss about autosclerosis. In this disease, genetic influence has a major contribution in its development. About 60% of patients report a family history of autosclerosis, and then measles exposure is also considered as one of the risk factors. Recent studies found viral materials in the nucleic acid of staped foot plates and antibodies to the measles virus in the inner ears of patients with autosclerosis. Last but not least, the doctor will perform a hearing function examination with an audiogram. These tools, in addition to medical history and physical examination, have traditionally been used for diagnosis of autosclerosis. An audiogram measures air and bone conduction and interactions throughout various frequencies at various loudness levels. After that, we proceed with tympanogram to see the middle ear. On extensive cases of autosclerosis, the patient's test demonstrates some flattening secondary to severe ossicular chain fixation. In certain situations, a CT scan or MRI of the ear may also be needed. High-resolution CT scan is beginning to be used in diagnosis and surgical planning of autosclerosis due to the improvement of technology allowing for identification of smaller bone lesions.
Now on to the next one. We all know that hearing aids devices are very useful for improving hearing and also understanding what other people say. People who have hearing losses are mostly due to damage to their tiny sensor cells in the inner ear. We'll call them hair cells. In this type of hearing loss is called sensorineural hearing loss. Damage can occur as a result of disease, aging, or injury from noises or any other certain drugs. This device increases the sound vibrations that enter the ear. The hair cells that survive detect the larger vibrations and convert them into nerve signals that are passed on to the brain. The greater the damage to a person's hair cells, the more severe the hearing loss, and also the greater of the implication of the hearing aid needed to make the difference. However, there are practical limits on the amount of amplification this aid can provide. In addition, if the inner ear is too damaged, then even the large vibrations will not be converted into nerve signals. In this situation, this device will be ineffective. If a patient's hearing care professional recommends this hearing aid, they will work with the patient to calibrate it with the patient's specific hearing loss during a process known as insertion. The basic purpose of this device is to amplify the voice. However, these aids can now be tailored into the specific needs of the patient and can also be amplified the sounds of the patient needs to hear while minimizing the sounds the patient does not want. While they can't exactly mimic normal hearing, they work very well for people with mild moderate hearing loss. Hearing aids can be worn behind the ear or on the ear itself, depending on the level of the hearing loss and personal preference. There are many types and styles of hearing loss. And yes, if the patient has hearing loss in both ears, two hearing aids are much better than one.
Hello, my name is YOVITA and I'm going to explain about hearing aids. Hearing aids are an alternative for patients with a hearing loss greater than 25 decibels who are not candidates for stave surgery or are in need of sensorineural hearing loss correction. Many autosclerosis patients use hearing aids to help with their hearing loss. Hearing aids aim to amplify sound and can be programmed according to user needs. In addition, a hearing specialist can help recommend the type and technology of hearing aids that's more suitable for the patient. Hearing aids is a small electronic device that you wear in or behind the ear. It has three basic parts: microphone, amplifier, and speaker. Next, are there different styles of hearing aids? Yep. First, behind the ear or BTE. These hearing aids consist of a hard plastic case worn behind the ear and connected to a plastic ear mold that fits inside the outer ear. The electronic parts are held in a case behind the ear. Sound travels from the hearing aid through the ear mold and into the ear. BTE aids are used by people of all ages for mild to profound hearing loss. A new kind of BTE aid is an open-fit hearing aid. This aid fits behind the ear completely, with only a narrow tube inserted into the ear canal. For this reason, open-fit hearing aids may be a good choice for people who experience a buildup of earwax, since this type of aid is less likely to be damaged by such substances. In addition, some people may prefer the open-fit hearing aid because their perception of their voice doesn't sound plugged up. Second, in the ear or ITE hearing aids. These hearing aids fit completely inside the outer ear and are used for mild to severe hearing loss. The case holding the electronic component is made of hard plastic. Some ITE aids may have certain added features installed, such as a telecoil. Telecoil is a small magnetic coil that allows user to receive sound through the circuitry of the hearing aid, rather than through its microphone. This makes it easier to hear conversations over the telephone. Third, canal aids. Canal aids fit into the ear canal and are available in two styles. First, the in-the-canal or ITC hearing aid that made to fit the size and shape of a person's ear canal. And second, a completely in-canal or CIC hearing aid that nearly hidden in the ear canal. Both types are used for mild to moderately severe hearing loss. Because they are small, canal aids may be difficult for a person to adjust and remove. In addition, canal aids have less space available for batteries and additional devices, such as telecoil. They usually are not recommended for young children or for people with severe to profound hearing loss because their reduced size limits the power and volume. There is also another treatment for autosclerosis patients, such as implantable hearing aids, that would be explained later.
Hello, my name is Michelle and I'm going to tell you about the different type of electronics that are used for hearing aids. The first one is analog. It converts sound waves into electrical signals which are amplified. It is also custom built to meet the needs of each patient. And then it is also programmed by the audiologist. It is also less expensive than digital aids. The next type is the digital one. It converts sound waves into numerical codes. It can be specially programmed to amplify sound frequencies, pitch, and volume based on patient needs. The audiologist can flexibly adjust the aid, and it is also can be programmed to focus on sounds that comes from a specific direction. The next one is implantable hearing aids. The first one is middle ear implant. Middle ear implants amplify sounds by mechanically vibrating the ossicles in which they are surgically affixed. These devices require ossicular chain motion, which is often limited in patients with autosclerosis due to bony deposits. Middle ear implants are indicated for sensorineural hearing loss and provide hearing improvement similar to traditional hearing aids. The second one is bone conduction implants. It is indicated for patients with conductive losses or mixed hearing loss with minor sensorineural involvement. These devices bypass the outer and middle ear, are attached to the temporal bone, and transmit vibrational energy direct to cochlea. Bone conduction implants can be implanted bilaterally but are typically implanted unilaterally because the vibration is often strong enough to stimulate the contralateral cochlea. Bone conduction implants are expensive and patients should try a traditional hearing aid first. The third one is cochlear implants. These devices convert acoustic signals into electric signals that are transmitted via electrodes to the auditory nerve. Bypassing the natural transmission of acoustic energy provides greater amplification in patients with sensorineural hearing loss. They may be more difficult to position surgically, and patients may have an increased risk post-operatively of cochlear ossification and facial nerve stimulation that may result in reduced functioning of implant itself or require more frequent implant revision or reimplantations. Although cochlear implants are beneficial for some patients, other research suggests that stapedectomy combined with hearing aids results in good outcomes in patients with severe mixed hearing loss.
Will be presenting about the conclusion of our presentation. So the conclusion is autosclerosis is the main cause for hearing loss. Hearing loss can be diagnosed through audiograms, tympanometry, and CT scan. Hearing aids is one of many technologies present in biomedics that helps patients with hearing loss to be able to hear better. There are 5 types of hearing aids and they are categorized by their position relative to the ear. The first is behind the ear or BTE, second is mini BTE, third is in the ear or ITE, fourth is in the canal or ITC, and last is completely in the canal or CIC. There are 2 types of electronic, and that is analog and digital. A hearing aid has 3 basic parts, and they are a microphone, amplifier, and speaker. These are the references we used in this presentation, and these are our responsibilities on this presentation. RUSYDA is working on the introduction, HILDA and SURYA is working on the methods, Michelle is working on the discussion, YOVITA is working on the discussion and editing, and lastly, me, NAUFAL IKRAM, is working on the conclusion.
Quote from our group: "The difference between hearing and listening is paying attention," by Ruth Messinger.
Thanks for listening to our presentation. Good day to all of you. Assalamualaikum warahmatullahi wabarakatuh.